Hello, my name is Alicia. I'm a DNP student at Robert Morris University, and you met Teresa earlier. She's also a DNP student here, and will be providing therapy for you, Jessica, and your son, Michael. Is it okay for us to talk in front of Michael, Jessica, and have him fill in the blanks as needed?
Oh, yes. He remembers more than I do.
Okay. Before we begin with why you're here today, I'd like to begin by getting to know you a little and know more about you and your son. Jessica, where are you from?
I'm from Pittsburgh.
Okay, and with who do you live now? Or are you currently living alone?
I live with my son. My husband passed away many years ago.
Yeah, my wife and I moved Mom into our house about 3 years ago after she had a stroke.
Okay. I'd like to discuss more about her stroke in a little bit, but I want to continue with some basic information first. Jessica, what is your highest level of education?
Well, I had to quit school to work, so about 10th grade.
Okay. And where were you employed?
Well, I did a lot of factory work until my kids were born.
Okay. And how many kids do you have?
I have two, Michael and Lisa.
Does Lisa live close to you?
She lives in here.
And have you always lived in Pittsburgh?
Yes, I've always lived in Ross Township. My husband was actually a police officer there.
Okay. Do you have any religious beliefs that are really important to you?
Yes, I believe in God. We're Catholic. I go to church every week.
Yeah, Mom has really strong faith. She used to go to St. Michael's, but now that she lives with us, we all go to St. Paul's every Sunday. We never miss.
Sounds like your faith is really important to you. Do you have any concerns about your religious needs not being met? Jessica?
Oh no, I love St. Michael's. I've gone there my whole life, but St. Paul's okay too.
Okay. We're just going to shift a little now to your medical history and current medications. Tell me about your past medical history and the stroke you suffered.
I have trouble with my blood pressure and I get headaches often.
She's had hypertension for probably about 15 years. She takes lisinopril every morning, like 20 milligrams, and she also had a mini stroke like 3 years ago, and they put her on a baby aspirin every morning. She was treated after that stroke. She regained most of her, or actually all of her physical abilities, but my wife and I have just been questioning her cognition lately. Her doctor, her PCP, he started her on Aricept 10 milligrams, and she takes that every night.
Okay. Where was Jessica treated for her stroke?
UPMC Presby. We were nearby at St. Paul's Cathedral when she began having symptoms. They treated her right away. She didn't have any physical issues at all. She had some right arm weakness, but with this physical therapy, she regained all of her strength back. Just the main concern was the memory, the attention, and her decision making, because we've just seen a decline lately.
Okay. She's lucky you noticed the symptoms so quickly and had her treated right away.
Well, I'm a nurse at Sewickley Hospital, so I noticed the signs and knew what to do pretty much right away.
She is very fortunate. I don't see any additional medical problems listed for Jessica in the records sent from her PCP either, but I'm just going to list some common symptoms, and then either of you can stop me if you've had any, if Jessica's had any of these. Fatigue, generalized weakness, dizziness, syncope, chest pain, shortness of breath, unintentional weight changes, any pains, skin changes, problems with urinary frequency or urgency, hair loss.
No, none of those.
Okay. And so as you indicated in the chart as well, she's just on the lisinopril 20 milligrams daily, aspirin 81 milligrams daily, and Aricept 10 milligrams at bedtime. Is this correct?
Yeah.
Jessica, do you have any allergies to medication or food?
What did I know of?
Does Jessica have any previous psychiatric mental health history?
No, she's never seen anyone and never had any depression or anxiety, anything like that. We just discussed her cognitive decline with her PCP. That's all.
Okay. And Jessica, have you ever had any current use of substances or alcohol or past use?
No.
Okay. Now we're just going to talk about your family's medical and mental health illnesses. I have the chart from your PCP here, so I'm just gonna kind of list what he has in there, and then you can add anything that's missing. So your mother was deceased at 86, and she had colon cancer and hypothyroidism. Your father was deceased at 32 from a car accident, also had a history of alcohol abuse. You had one brother that died at 5, also in a car accident. Your maternal grandmother was 80, deceased. She had cancer and was described as a warrior. Maternal grandfather, 79, deceased from a heart attack. Maternal grandmother, 76, deceased, cardiac disease. And your paternal grandfather, 68, deceased from alcohol abuse. Your daughter, that we had mentioned earlier, is 49, alive and well, just has hypothyroidism. And your son, Michael, 52, alive and well, with just hypertension. Are there any other medical or psychiatric problems in your family that you're aware of? Any suicide, suicide attempts, mental health disorders, inpatient admissions, drug or alcohol abuse? Anyone die or have a sudden cardiac event before the age of 45? No. Any other medical disorders that weren't listed above, such as thyroid problems, hypertension, CHF, MIs, diabetes, hyperlipidemia, or cancer?
No, I think you have everything.
Yeah, no? Okay. We'll now just discuss a little bit about what brought you in here today.
My wife and I have noticed Mom's becoming more forgetful over the last 3 years since she had the stroke. We moved her into our house because she was forgetting to do things like pay the bills. Once she left the stove on and fell asleep, she wasn't taking care of herself properly, and she wasn't taking care of the house either. We felt her safety was in danger, so we moved her in with us, and she's now become very angry, and we're seeing behaviors that are concerning to the both of us.
Okay. So let's start by saying, when did you start seeing this decline in her cognition?
Probably about 6 months after the stroke. I remember we received a call from Duquesne Light. They said that she hadn't paid her electric bill in the last 3 months, and that's not like her at all.
Tell me about her symptoms now and what prompted you to come in today. Behaviors and the agitation you mentioned.
Well, we've been concerned about her memory issues for quite a while, and we discussed these concerns with her PCP, Dr. Smith, and he started her on the Aricept 5 milligrams, and then increased it after that to 10 milligrams. Her cognitive decline seems to have plateaued with the Aricept, but now she's become more combative. She strikes out, becomes agitated over pretty much nothing, and this has started to happen pretty much on a daily basis.
Okay. Jessica, have you seen any of these symptoms that Michael was talking about?
Well, I guess I do forget some things, and I mean, I didn't mean to leave the stove on that time.
Yeah. Sometimes those can happen after a stroke, those symptoms. Do you feel agitated throughout the day or feel like you can't control your emotions?
Sometimes I get frustrated easily, and then I feel really mad.
Okay. Do you know what happens before you get upset?
I just can't do everything I used to. I used to love to cook and drive, and I can't do that anymore.
So you've been frustrated lately to not being, since not being able to cook or drive on your own.
Yes.
Have you ever felt sad or down too?
Sometimes I feel sad.
Do you ever feel like you no longer want to do things that you once enjoyed, like cooking or getting out of the house on drives?
Oh no, I wish I could do all those things.
Do you ever feel like your situation right now is kind of hopeless or helpless, or that you're worthless?
No, not really. I just get sad and sometimes mad when I can't do the things I used to do.
It seems like her moods change often. She goes from being mad and throwing things, or sad and tearful. This has been going on for about 3 months.
Do you believe, Michael, that she's a danger to herself or anyone else when she becomes agitated?
I don't believe she has any intent to harm herself or anyone else. She doesn't like throw knives or anything. Just like slamming glasses down or slamming doors when she's frustrated.
Okay. So Jessica, do you ever feel like you want to harm yourself or others?
Oh no, I don't want to hurt anyone. I just get so frustrated.
We'll discuss your frustrations and try to decrease increase those through therapy, and we may have some medication options.
That sounds good.
Okay. How are you sleeping?
I sleep okay.
She goes to sleep around 9 o'clock at night usually, gets up about 5 a.m. Probably throughout the night she's up about once or twice to go to the bathroom.
Okay. Do you find that you have any extra energy or ever not need to sleep at night?
Oh no.
No, I haven't seen any mania or hypomania, anything like that.
Okay. How is your appetite? Have you lost or gained any weight recently?
Oh, I'd say it's the same as usual. I don't think I've gained or lost any.
No, I agree. She's eaten most of her meals and her weight appears to be pretty stable.
And have you ever felt like life isn't worth living or you'd rather not be here anymore?
Oh no.
Sometimes she throws things, but it's never at us. She doesn't try to hurt us or herself.
Okay. Have you had any worries lately or felt nervous?
No, not really. Michael and his wife take really good care of me. I mean, they help me pay my bills and help me cook.
Do you ever feel like restless or irritable when you're frustrated?
She doesn't seem restless, and we talk a little bit about her frustrations, and I don't think that it's really related to her anxiety.
Okay. It doesn't sound like anxiety is a problem for you, Jessica, but I'm going to list some symptoms just to make sure. I want you to stop me if you've had any of these things. Nightmares, social anxieties, phobias, an increased startle reflex, feeling on edge, or muscle tightness or pains.
I haven't seen any of those either.
Okay. Jessica, do you ever see things or hear things that maybe other people don't see or hear?
No, I don't.
Do you ever feel like someone is out to get you?
No.
And Michael, do you ever think your mom is seeing or hearing things that may not be there? Like, have you ever seen her talking to someone that you don't think is there?
No, I've never seen nothing like that.
Okay, Jessica. Just a few more questions that I have to ask everyone. Can you tell me the date today?
I know it's November. I think it's the 20th of 2018.
Very close. It's actually Thursday, November 29th. It is 2018.
Oh dear, I must have lost track.
Maybe you can get a watch that helps keep you updated with the date and time, so you know.
We can do that. Yeah.
Okay. And Jessica, do you know where we are at today?
I think we're in Pittsburgh, and we're in a hospital.
Okay. We're actually in Moon Township. That's about 30 minutes outside of downtown Pittsburgh. And we are in a hospital, so very good. I know Teresa gave you a little test before you came in to see me, but I just want to ask a few more questions about that, okay?
That's fine.
I'm going to give you a list of items to remember, and then I might ask you about them later. The items are dog, ball, and flower. Can you repeat those back to me?
Dog, ball, flower.
Okay, great. So Jessica, do you know who the current president is?
Oh dear. I believe it's that famous guy on TV.
Do you remember his name?
I don't recall.
His name is Donald Trump.
Oh, that's right. That's right.
Now Jessica, can you spell truck backwards for me?
Oh, I'll try. K C R T.
Very close. We just left out the U. Let's try something different. Can you tell me how many quarters are in $1.25?
Oh dear, I was never good at math. Let me see. Let's say 6.
Close. 5 quarters make up $1.25.
Okay.
Okay. Can you tell me how a cat and a horse are alike?
Well, they both have 4 legs, and they both can live on a farm.
Very good. Now we talked about 3 items a few minutes ago. Can you recall what those items were?
There's a dog. I don't really remember the rest.
Okay. The next item is something round that soccer players use.
Oh, a ball.
Mm-hmm.
That's
Good.
right.
And the final item can be given as a gift, grown in a garden. They often smell very fragrant.
Flower?
No.
Oh,
Okay, one more question. Can you name 3 items I'm going to show you?
a pen, a a watch, and a shoe.
Okay, very good. Thank you very much, Jessica and Michael, for providing so many answers to all my questions. Do either of you have anything more to add or any questions of your own? No? Okay. Then I think we'll talk about my thoughts as far as diagnosis and treatment, agree on a plan together, and then Teresa will be able to talk with you about some therapy options. So with the information you provided for me today, I believe Jessica has what is known as major vascular neurocognitive disorder. There's evidence from her chart that she had a left MCA stroke about 3 years ago, that she's had a significant decline in cognition and complex attention, executive functioning, and memory that was witnessed by both you and your wife since then. They seem to have appeared quite immediately after the stroke, and then in 2016, when she had seen her PCP, they had done a mini mental state exam, and her score was 26 out of 30. Teresa had repeated that today, and it was 21 out of 30. Further, I believe Jessica is showing the complex attention problems, which are often most prominent in this disorder, including her ability to process quickly and use executive functions. If it's okay with you, Jessica and Michael, I think I would recommend continuing the Aricept at 10 milligrams at bedtime, as long as you're not having any side effects or problems from that. As you know, this medication will not improve your memory or cognition, but it has been shown to stabilize these. Michael, you mentioned that Jessica's cognitive decline seems to have stabilized, so in my opinion, the Aricept is doing what it's intended to do. If you wanted to stop it, you may see a drop-off in cognition. Okay. So there are other medications that we can discuss using in the future if needed, based on specific concerns and progression of Jessica's neurocognitive disorder. I know that you didn't come in with concerns about deteriorating cognition. You feel that it has been stable, but there is some evidence from her mini mental state exam that it has gotten a little bit worse. It was 26 in 2016 and it is now 21. However, I would like Teresa to do another mini mental state exam in about a month, just to see if we're kind of stable as we're where we are today. If that declines further, or if we're concerned at home about it, we can start a medication called Namenda. It can be used in conjunction with Aricept and may stabilize and slow memory loss and cognitive decline. And it can also be used to deter behavioral effects of the neurocognitive disorder, but it hasn't been thoroughly proven to do so in the research. So the next group of medications that we could also consider are called second-generation antipsychotics, and they include medications such as Risperdal, Zyprexa, and Seroquel. These medications in low doses may help with agitation and dangerous behaviors that are often seen in patients with dementia or neurocognitive disorders, which seems to be the focus of your main concerns today and why you came in. So these types of symptoms are common in neurocognitive disorders and don't really have a diagnosis of their own per se, but are referred to as behavioral and psychiatric symptoms of dementia. Although these medications, second-generation antipsychotics, have been successful in helping reduce agitation and behaviors, research trials have shown significant adverse side effects for these medications, and effectiveness may be no better than a placebo. Because of the many side effects, I would prefer to wait to see if behaviors and agitation symptoms could decrease with the use of therapy, education, relaxation techniques, and some psychoeducation. If that is a route you would like to take, we can discuss the side effects at that time.
Yeah, I think we'd like to try therapy before we add any more medications.
Okay, Jessica, how do you feel about that plan?
That sounds good. I just don't want to take any more medications right now.
Okay, I agree with you both, and I think therapy and behavioral modifications are a great place to start as long as you have no concerns for Jessica's safety or the safety of others during her outbursts. We can always discuss adding medication in the future if needed.
Okay.
Okay. I would also just like to mention sleep can be a big factor in agitation and mood changes, especially in those with neurocognitive disorders. I would recommend maintaining Jessica's sleep hygiene. It sounds like everyone has done a great job of keeping her on a schedule, going to bed at 9 p.m., waking up at 5 a.m., and it seems to be working well for her. She should try to continue her same bedtime and morning routines and stay away from bright lights and screens about 1 hour before bedtime. I would also just encourage you to have night lights around the house so she can get up safely and independently to use the restroom at night. Lastly, I would just like you to follow up with your PCP for any labs, urine cultures, urinalysis, and have any results sent to my office as well. If you have any questions about the medication or side effects that you're currently on or ones you're considering in the future, please call the office. If you see any further cognitive decline or behavioral changes that are concerning to you, call the office for an earlier appointment. But as of right now, I think I'd like to see Jessica back in about 3 weeks to see how well we're doing with therapy and if there's been any change for her.
Okay, we can do that.
Are there any questions for me?
No?
No?
Thanks very much.
Thank
You're
you.
welcome. Now I'm just going to have Teresa talk to you about some behavioral interventions and therapy.
Hi. Thank you for coming in today and discussing this. I know it's a lengthy appointment, but we want to get to know you better to devise a treatment plan that's going to get you feeling and functioning better, which is our goal. And these goals are measurable in time, and we'll revise them as time goes on towards these goals, and we can look at that each visit. I'd like to talk to you a little bit about the behavioral and psychological symptoms of dementia, or BPSD. BPSD is described as a range of psychological reactions, psychiatric symptoms, and behaviors occurring in people with dementia. Unlike cognitive symptoms of dementia that tend to worsen over time, this BPSD symptoms tend to fluctuate. Non-drug treatment, which Jessica, you desire to talk about more, includes psychoeducation and to change your behaviors and to improve knowledge of the dementia that's happening through cognitive stimulation therapy, behavior therapy, multisensory stimulation such as music, and therapeutic activities such as art and pet therapy, and some social programs that we can talk about. There's a multisensory environments that are relaxing spaces that can help you reduce your agitation and anxiety, and this will help you get engaged and delight you while using this. And
Oh,
does that sound like something that you would like to talk about?
Yeah, that sounds nice. What do you think, Mom?
I think I would like that. I just don't want to take any more medication.
I understand. Okay, that's a great choice. I think that this will really benefit you, Jessica, and help you reduce this frustration that you're describing. We can get you more information on a place like that before you leave today. Next, I'd like to talk about how to help reduce your frustrations at home. The first step is identifying these triggers. What triggers your frustration? Are you able to tell me anything that you think triggers that?
I don't know. It's just one thing or another.
Earlier, I heard you say that you feel frustrated that you can't do the things that you used to enjoy, such as cooking and driving.
Yes, yes.
Michael, are you able to identify anything that triggers Jessica's outbursts?
Not really. I understand she must be frustrated by her loss of independence, but it seems like anything can pretty much trigger her outbursts.
Michael, it's really great that you were able to identify that Jessica is frustrated by her loss of independence. It can be helpful to know that she is understood. Have you heard of the PIECES ABC tool?
No.
It's a tool that we can use to help identify factors or pieces that may contribute to Jessica's outbursts or responsive behaviors. It can also tie the pieces or antecedents to the behavior and help determine appropriate consequences. Here's a copy for you to look at. For the PIECES tool, there are several groups of stressors, including physical, intellectual, emotional capabilities, environment, and social, that can precede these responsive behaviors. Within each of these groups of stressors, there are different ideas that listed that can trigger Jessica's outbursts. For instance, in physical, such as hunger, thirst, pain, and not having her glasses or hearing aids can trigger her responsive behaviors. Also, if you look at the emotional, things such as depression, grief can be causative factors, but also boredom and loss of independence that you've described. Can you identify anything else in the list that may trigger Jessica's outbursts?
I guess she probably is experiencing some social isolation. She used to go to the beauty parlor right by her house every month for a perm and had a lot of friends there. Lately, my wife's been taking her to her salon because it's just easier for both of them to go together. Well, do you miss seeing your friends at your beauty parlor?
Oh yes, I never see my friends anymore.
Great job, Michael. Jessica, it is obvious that Michael cares about you and wants to help improve your quality of life. Is there anything you think he can do to help you see your friends?
I don't know, but I would really like to see them.
Would you like me to take you to your beauty parlor every month so you can see your friends?
I would like that very much.
Okay, maybe we can even get your friend Rose out for coffee afterwards. That's what you used to do, right?
I think so. That would be very nice.
Good work, Michael and Jessica. Michael, can we look at that list one more time and see if we can find anything else that may be triggering Jessica's frustrations?
Maybe feeling like my wife and I kind of took over. She might feel like she lost her say. Like when we decided to move her in with us, you know, she had to stay in one of our rooms, and she had to. She can't do things like drive. She, you know, can't help make. She doesn't get to make her own dinner anymore, which I know is something that she really used to enjoy doing, was making dinner. So I would say loss of independence, lost her say.
Jessica, does it sound like these things are bothering you?
I mean, they do take good care of me. I do really miss cooking for my family, though.
Michael, is there anything that we can do to help Jessica here?
Well, we're worried about you leaving the stove on. That's happened in the past. And we just want to make sure that you're safe. Do you think you'd enjoy helping us cook dinner, and maybe we could do it like once a week together?
Well, I think I'd like that, yes.
Great. It sounds like you two have identified some triggers for Jessica and developed some plans to help her cope. I want you to take this list home and look it over and write down, Michael, when you see an outburst from Jessica, and then later we'll analyze that and look at some factors that play into that. Do you think that this is a homework that you could do?
Definitely. I didn't realize that some of the things we were doing to help her were also harming her.
Michael, you acted in a way that shows you care about your mother's safety, and this should be top priority. Now our job is to figure out ways to help improve her quality of life without jeopardizing her safety. Does this make sense?
Yeah, definitely. I'm just wondering, what do I do to manage her behaviors and outbursts if we don't know what all of her triggers are?
Absolutely, that's the next step. These pieces that you identify then go to another part of the toll on the second page that I gave you. If it's the ABC or antecedents, the piece is behavior consequences. For instance, if the piece is that Jessica is feeling frustrated and starts throwing things in her room, how are you going to respond?
I don't know.
Okay, that's what we're going to work on. So we identified her loss of independence and feeling like you took over as antecedents that trigger her behavior of throwing things in her room. What do you think you could do to help Jessica deal with her frustration before she has an outburst?
Maybe I could tell her that we're about to start dinner and ask her if she likes what I'm making, and then maybe remind her that Sunday is our day to cook, and tell her how many days away Sunday is, and maybe even invite her to come sit in the kitchen with me while I cook and ask her for advice or direction.
I think that sounds like a great idea. You could actually tell her step by step how you would cook something. And Jessica, what do you think about that?
Well, I think I would like that. I really like to cook, and the smell of food in the oven is wonderful.
Okay, great. I think it sounds like there's a good place to start here. And I do encourage you to write these things down and try to brainstorm other ways to address these possible triggers that Jessica's having before her behavior escalates. Caregiving is a hard job, Michael, and you're doing a really good job for your mother. I'd like to see you back in 1 week and do weekly sessions for at least the first month. I want to make sure that Jessica's safety is our top priority, and that we reach out to Alicia if any concerns of worsening behavior or need for reevaluation before you follow up with her in 3 weeks. Do you have any questions for me?
No, I want to thank both of you for helping us today and including us in the decision making. Juan, do you have any questions?
No, just know I don't want to take any more medications.
I understand. Okay, well, we hope that some of these interventions will be effective and that they won't be necessary, but it is a possibility down the road, especially if we are concerned for anyone's safety. Thank you for coming in today and talking with us, and it was nice meeting you both, and we'll see you in 1 week.
Thank you.
Thank you.